Welcome to Things You Don't Know. In this episode, we will focus on medical and psychological treatments and fads that have proven useless or harmful. One of the confounding factors in researching this topic is something called the placebo effect. What is a placebo effect and how does it work? Well, the primary mechanism behind the placebo effect is the patient's expectation and belief that the treatment will work. This belief can lead to changes in brain activity and the release of neurotransmitters such as endorphins and dopamine, which can reduce pain and improve mood. Now, conditioning, another aspect of this, past experience with effective treatments can condition patients to associate specific actions like taking a pill with positive outcomes. When they receive a placebo, their bodies react similarly to how they would react to an actual treatment. The placebo effect can also be influenced by psychological factors such as the doctor patient relationship, the environment in which the treatment is given, and the rituals associated with taking medication. Also, believing in the efficacy of a placebo can lead to measurable physiologic changes. For example, placebo treatments have been shown to affect heart rate, blood pressure, and immune response, among other bodily functions. So, placebos can relieve pain, as the expectation of relief can trigger the brain to release natural painkillers. Depression. Placebos have been found to improve symptoms in patients with depression, possibly due to the activation of brain areas involved in mood regulation. In some studies, it's shown that placebos can improve motor function in patients with Parkinson's disease by increasing the dopamine release in the brain, as we've already discussed. Here's an interesting one. I personally know a current placebo effect that is ongoing. Now, this person goes into a chiropractor, which she pays significantly for, with a complaint and is told they will be tested to determine what is causing the problem. They're giving a completely closed glass vial. In other words, whatever's inside cannot affect what's going on the outside unless it's radioactive, which is not likely. Okay, so this vial that the person is handed supposedly contains a specific substance, and the patient is told, close your eyes and hold it in your hand outstretched. If the hand goes up, they're told the substance in the vial is curative of whatever symptom they were complaining about. If the hand moves down, they're told the substance is causing the problem. Based on this test, I read that in quotes, the patient is sold a vial that they take home and hold in their hand, which is supposed to cure whatever illness they have. I mean, talk about bone rattling and placebo effect. That's it. In fact, the patient may feel some symptomatic relief over time. It is clear that the diagnostic procedure and treatment is gobbledygook and only is somewhat effective because of the placebo effect. So, understanding the placebo effect is important in clinical trials as it highlights the need for control groups that do not know if they're getting real treatment or placebos to differentiate the actual efficacy of a treatment from the psychological effects of believing in the treatment. It also underscores the power of the mind body connection and the potential benefits of harnessing positive expectations and beliefs in therapeutic settings.
Let's start by understanding what a medical fad is. Medical fads are popular health practices or treatments that gain rapid popularity. often without solid scientific evidence to back them up. They can range from supplements and diets to more invasive treatments. While some may have a placebo effect, others can be downright dangerous. One of the earliest examples of a medical fad is snake oil. In the 19th century, snake oil salespeople roamed the United States peddling them miracle cures. These concoctions were claimed to cure everything, from arthritis to baldness. However, most snake oil products contain little to no actual snake oil, and are often just a mixture of alcohol, turpentine, and other substances. The term snake oil salesman has since been synonymous with charlatans and quackery. One of the oldest and most widespread harmful medical practices was bloodletting. Dating back to ancient Egypt and Greece, bloodletting was based on the belief many diseases were caused by an imbalance of bodily fluids known as humors. Physicians would cut patients or use leeches to drain blood, believing this would restore balance and health. In reality, bloodletting often weakens patients, leading to infections and, in some cases, death, as with our first president, George Washington. Despite its dangers, bloodletting persisted for centuries until the 19th century, when medical science began to reject the humoral theory.
Trepanation, the practice of drilling holes into the skull, dates back to prehistoric times. It was believed to release evil spirits, cure headaches, and treat mental illness, as well as a variety of other conditions. Ancient civilizations, including the Greeks and the Mayans, practiced trepanation. While some patients survived, many suffered from infections, brain damage, and a little trivial thing like death. Today, trepanation is recognized as a dangerous and ineffective procedure replaced by more advanced neurological techniques. Now, it is true that sometimes it is necessary to drill into the skull. It is done under microscopic and highly sterile conditions and done for a specific reason to relieve intracranial pressure, for example. But trepanation was literally stick a drill to the person's head and drill. In the early 20th century, you'll love this one, radium was hailed as a miracle cure for a variety of ailments, including cancer, arthritis, and even aging. Radium infused products like water, cosmetics, and toothpastes were marketed as health enhancers. However, radium is highly radioactive and can cause severe health problems, including bone fractures, anemia, cancer, and again, a little thing like death. The most famous case is that of the quote, radium girls. They were factory workers who painted watch dials with radium, so they glow in the dark and stuff, and suffered horrific health consequences. This led to greater awareness of the dangers of radiation and stricter regulations on its use. Another little goodie, lobotomy. The lobotomy is a surgical procedure that involved severing connections in the brain's, usually the prefrontal cortex, but it could be other things too. And it was introduced in the 1930s as a treatment for severe mental illness. It was developed by a Portuguese neurologist, Antonio Egas Moniz. The procedure became widespread, particularly in the United States. However, lobotomies often resulted in severe cognitive and emotional impairments, personality changes, and even death. By the 1950s, the development of antipsychotic medications and growing ethical concerns led to the decline of lobotomies. Now, do we know of somebody famous in history that had that? Yeah. Who would that be, Dr. Deneen? It would be the Kennedy girl.
Yes,
Remember?
President Kennedy's sister Rosemary.
Yep. And it really didn't do her any favors.
No, it took away what cognitive abilities she had. Mercury was used for centuries as a treatment for various ailments, most notably syphilis. In the 16th century, Paracelsus, a Swiss physician, popularized the use of mercury ointments and pills. However, mercury is highly toxic, and prolonged exposure can cause severe neurological and physical damage. Patients treated with mercury often suffer from tremors, kidney failure, and once again, that insignificant thing called death. It wasn't until the discovery of penicillin in the 20th century that mercury treatment for syphilis was abandoned.
Next, let's talk about detoxes and cleanses. Sounds good, right? Many people turn to detox diets such as juice cleanses and even colonics. That's an enema to purify their bodies. However, our bodies are pretty well equipped with a highly efficient detoxification system, our liver, kidneys, and intestines. Studies have shown that these detox regimens can not only be ineffective, but can also be quite harmful. They can lead to electrolyte imbalances, dehydration, and even organ damage in some cases. Besides, you want to go in and have a enema like once a week just for fun? I don't think so. Another one of the most controversial and harmful medical fads is the anti-vaccine movement. It gained momentum from a now debunked study published in 1998. 1998, so it's not a long time ago, that falsely linked the MMR vaccine to autism. This has led to a significant decline in vaccination rates, resulting in outbreaks of preventable diseases like measles, whooping cough, some other little goodies like that. Maybe even think about the pandemic and problems with that. So, extensive research has shown that vaccines are safe and effective, and the original study has been retracted, and the author loses his medical license justifiably.
Homeopathy is another wildly popular yet scientifically unsupported treatment. Developed in the 18th century, homeopathy is based on the principle, quote, that like cures like, and uses highly diluted substances to treat various ailments. Numerous studies have shown that homeopathic remedies are no more effective than placebos. Despite this, the industry continues to thrive, with people spending billions of dollars on these often ineffective treatments each year.
Yeah, homeopathy is a joke. Miracle cures and dietary supplements. Boy, there's some money makers there. That's a booming industry, but they come with significant risks. Products like Miracle Mineral Solution, or MMS, have been marketed as cures for everything from cancer to autism. Sound familiar? Yeah. However, MMS is essentially industrial bleach. Bleach, dudes, bleach. And consuming it can cause severe harm, including nausea, vomiting, and once again, that little insignificant thing called death. The supplement industry is also very poorly regulated, meaning that products can contain harmful ingredients or not contain the advised substances at all because it is not regulated by the government.
Here's another myriad of unique things, dietary ideas. From the Atkins diet to the more recent keto and paleo diets, fad diets promise quick weight loss and health benefits. However, these diets can be nutritionally unbalanced and unsustainable in the long term. For example, the keto diet, which is very low in carbohydrates and high in fats, can lead to nutrient deficiencies, digestive issues, and increased risk of heart disease. It's essential to approach dieting with a focus on balance, sustainable eating habits rather than quick fixes. Thalidomide, introduced in the late 1950s as a treatment for morning sickness in pregnant women, became one of the most infamous medical disasters in history. It was later discovered that thalidomide caused severe birth defects, including limb deformities, in thousands of babies worldwide. A very dear friend of mine lost all four limbs that way.
Oh boy, that's terrible.
The thalidomide tragedy led to stricter drug testing and approval processes, significantly improving drug safety standards. While it can be tempting to try the latest trend for health or a miracle cure, it is crucial to approach these things with skepticism and seek advice from qualified medical professionals. Many medical fads are not only ineffective, but can also pose serious health risks. Remember, friends, if something sounds too good to be true, sadly, it probably is.
Indeed. No, and the other part of this was looking at mental health fads, etc. Now, we know that mental health is a critical aspect of our overall well being, but it is also an area rife with misconceptions and trendy but ineffective treatments. Mental health fads often promise quick fixes for complex issues, but these solutions are rarely backed by solid evidence. Let's take a little bit of a closer look at some of the most popular mental health fads today and uncover the truth behind them. Just a little history here. In the past, there were a number of ineffective treatments ranging from extraction of a patient's entire set of adult teeth. Sounds like fun, huh? A common treatment in the 1910s because mental illness was thought to be caused by an infection. And we know that you can have some infection from your teeth. Okay. Another discredited treatment was insulin shock treatment. Now, what is that? You give somebody enough insulin until they go into a coma, and that is supposed to help them. God knows what they thought about when they were doing that. I've seen little movie clips of that, and it is horrific. A person is seizing and having all sorts of problems, and they have to have a medical team there to revive them, to get them out of it. Really cute stuff. Another discredited treatment was giving LSD, acid, which was thought to erase trauma and unpleasant memories known as de-patterning. New, more positive memories were to be both experienced in reality and implanted. God knows. De-patterning is a controversial and largely discredited technique in the field of psychology and mental health treatment. Thank God. It involves the use of intensive and also often extreme interventions to break down a patient's existing thought patterns and behaviors with the goal of reshaping their mental state. The champion here was Dr. Ewan Cameron in the 50s and 60s as part of experiments funded by the CIA MK Ultra program. A wonderful thing, right? Dr. Cameron, who was a psychiatrist, conducted experiments at the Allen Memorial Institute in Montreal, Canada. Interesting that he had to go there. His work involved methods such as high doses of LSD, electroconvulsive therapy or ECT, and prolonged sensory deprivation. Could say a lot more about that one. MK Ultra program, as I said, they were part of the CIA's MK Ultra project, which aimed to explore mind control techniques during the Cold War era and also used during the Vietnam War. And several people were treated to that treatment to see if it would make them better soldiers. It was really wonderful. And most of them had to get sent home to hospitals. So, what happened in this? Okay, they were given like high doses of LSD, and that's a pretty powerful hallucinogenic, and it was believed to disrupt normal cognitive processes and create a state of heightened suggestibility. Another champion of this was our good old friend Timothy Leary. Check him out. Not a pretty picture. ECT. Cameron used, this is a doctor we were talking about, used intensive ECT sessions, much more frequent and more powerful than standard therapeutic doses, which are done today to further disrupt mental functioning. The sensory deprivation that I mentioned, patients are subjected to prolonged periods of sensory deprivation, which involve isolating them in environments devoid of sensory stimulus. What they would do is they would put them in this thing which looked remarkably like a kind of enlarged casket, floating in water, completely cut off from sound. They couldn't sense anything through the skin because they were just floating in the water. Yeah. Later studies have demonstrated that that can cause real, long lasting damage and psychological problems. Can you say PTSD? Good way to institute it. Put them in a sensory deprivation chamber for long enough and they'll have it. The goal of de-patterning was to erase those memories, behaviors, and thought patterns that were and effectively cause a blank slate. Yeah, not a happening thing. Ethical violations of this, okay, they were highly unethical, often conducted without informed consent, and led to significant psychological and physical harm to patients. The methods didn't result in any of the intended positive outcomes. Indeed, they often cause severe trauma, long-term mental health issues, and cognitive impairment. Yeah, it kind of made them stupid. Yep, happens when you kill off part of the brain. So, due to these unethical nature and harmful effects of these experiments, de-patterning as a treatment method has been discredited and condemned now by the medical community. Real good use of the money the CIA made, huh? Today, there is some research that's going on in a more controlled and ethical manner. I certainly would not want to recommend that treatment to anyone. In summary, de-patterning as practiced in the past, particularly with the use of LSD, is a dark chapter in psychiatric history. Current research on psychedelics for mental health is fundamentally different, prioritizing patient safety, ethical standards, and scientific validity. However, I still do not recommend it personally.
Detoxification diets and products are often marketed as a way to cleanse both the body and the mind, promising improved mental clarity and emotional stability. However, as we said before, our bodies are naturally equipped to detoxify through the liver and the kidneys, and there is no scientific evidence that detox products enhance mental health. In fact, strict detox regimens can lead to nutritional deficiencies and mental fatigue, exacerbating rather than alleviating mental health issues. Another fad is essential oils and aromatherapy, which have gained popularity as treatments for anxiety, depression, and other mental health conditions. While certain scents like lavender may have a mild calming effect, they are not a substitute for evidence-based treatments like psychological therapy and medication. Over-reliance on essential oils could lead to neglecting professional treatment and exacerbate mental health conditions. Light therapy, especially the use of happy lights or light boxes, is often touted as a cure for SAD, seasonal affective disorder, and general mood improvement. While light therapy can be effective for some of the individuals with SAD, it is not a universal solution for depression or anxiety. Misusing light therapy, especially without professional guidance, can disrupt sleep patterns and lead to other health issues.
One of the fads in psychotherapies today is something called mindfulness, okay, which, in my opinion, typically devolves rather quickly in practice to having a quote positive lens as a cure all. You know, in my career, I supervised a lot of beginning therapists, many of whom said they use this technique. But when I questioned them, they could not answer even simple questions about the technique or explain how the approach is curative of the issues that a patient comes to therapy to deal with. Okay, now, I'm not saying that mindfulness and meditation have no beneficial effects, because they do. They have well documented benefits. But the explosion of mindfulness apps and superficial training of therapists has led to a superficial understanding of these practices. Many apps often offer quick meditation sessions that may not address deeper mental health issues. Now, as a stopgap, those sessions are good and important if it is followed up by exploring what was the root cause. It's important to approach mindfulness as a long-term practice, ideally with guidance from a properly trained professional. The power of positive thinking. If I hear that again sometime, I feel like I may throw up, because it's supposedly some sort of panacea, and it isn't. It is a popular self help mantra, but it can sometimes lead to toxic positivity. What do I mean? It promotes the idea that one should always maintain a positive outlook. Sounds good so far. Even in the face of significant challenges. Sounds like denial to me. However, when you do this, you denying or suppressing negative emotions can prevent people from processing and addressing underlying issues, leading to recurring and increased stress and anxiety. A romper room no no.
The market is also flooded with, quote, natural supplements claiming to treat mental health conditions. Products like St. John's wort, omega-3 fatty acids, and various herbal supplements are often marketed as natural remedies for depression or anxiety. However, these supplements can interact with medications and may not be effective for everyone. As my old physical therapist, Dr. Andrew Kramer, used to say, tree bark is natural. It doesn't mean you're going to eat it. Also, always consult with a healthcare provider before starting any supplement regimen.
Another great myth, both in medicine in general and psychology in particular, concerns eating only organic foods as a cure all. There are some big problems with this. The first is called greenwashing. This refers to the fact that there is no reliable and consistent standards for what constitutes organic. So, Dr. Deneen, if you want to get into the organic thing, you know, go out in your backyard and plant a few plants, and instead of letting the people in your household go to the bathroom and the toilet, just stick it on the plants, man.
No, I think I'll give that a pass.
Oh, well, so much for your adventurous nature. Another tricky thing is that people often think that organic means no pesticides are used in organic farming. Well, that is just bunk. It is not true. Organic farming uses pesticides, has to. Otherwise, the crops would be eaten up by, all the little critters. But because they don't use the industry standard pesticides, you usually have to use a whole lot more to get the same protection. I would go on to include the problem of using manure in large amounts for fertilizers. As I said, don't take a dump in the toilet, dump on the plants, right? Problem with that is, guess what? You buy something organic and you see that little brown stuff on there? That's probably manure. Yeah, so when you get organic, you need to really be careful that you wash it before you eat it. It's just a really good thing. Also, the damage to the soil. Why is it damaging to the soil? Well, because it sucks up more nutrients in some ways, but it also means that you have to use other kinds of things to replace those nutrients in the soil, which means the soil actually gets damaged. And it also takes a whole lot more land space to do, quote, organic farming, meaning that more land is used, and so on and so forth. The bottom line is that organic can mean higher quality. It really can. It usually does not. And the effect on mental health, even if it does, is minimal at best. Minimal.
Another factor that's not so much incorrect as incomplete is the idea that mental health disorders are solely caused by a chemical imbalance in the brain. That idea has been very widespread. This oversimplified view has led many to believe medications alone can cure conditions like anxiety and depression. While medications can and should be an essential part of treatment for many, mental health is influenced by a complex interplay of biological, psychological, and social factors. Therapy, lifestyle changes, and ongoing social support are also crucial components of any effective treatment.
If you didn't catch everything he said, you need to listen to it again because what he said is critically important. You're right on, Dr. Deneen. Herbal supplements like St. John's wort and ginkgo biloba have been touted as natural cures for depression and anxiety. Yeah, research on their efficacy is mixed. And grok this for a moment. They interact very dangerously with prescription medications. For example, St. John's wort can interfere with antidepressants, birth control pills, and blood thinners. Marvelous. So, according to that, you take St. John's wort and maybe get some relief from depression and die of a stroke because your blood isn't thinned properly. Cool. It's essential to consult with a healthcare professional who knows something about supplements and all that stuff before starting any supplement regimen.
With the rise of social media, many people turn to platforms like Instagram and TikTok for their mental health advice. Not a good idea. While these platforms can provide a sense of community and raise awareness about mental health, they are not a substitute for professional help. Self diagnosis based on social media posts alone can be harmful, leading to misdiagnosis and inappropriate treatment. It is important to seek information and support from licensed mental health professionals.
Here's another good one coming here. Positive vibes only. Well, the positive vibes only movement promotes the idea that maintaining a constant state of positivity can improve mental health. And I say superficially, amen. While optimism and positive thinking can be beneficial, denying or suppressing negative emotions can be harmful. As we've said before, sadness, anger, fear, they're all natural. They play a crucial role in our mental well being. If you don't ever experience those things, you're probably not going to learn very much, and you're probably going to end up in a uh, gerbil wheel of going through the same stuff all over again, every time, every time. Not a good idea at all.
The internet is filled with mind hacks that promise quick fixes for mental health issues, such as improving memory, reducing stress, or increasing happiness. Some techniques like meditation and mindfulness do have evidence-based benefits. Many mind hacks are oversimplified and lack scientific support. Sustainable mental health improvement, like sustainable physical health improvement, requires consistent effort, professional guidance, and lifestyle changes.
Here's another favorite of mine. It's called the issue of iatrogenic antecedents. And this is focused around the overprescription of medications. Now, what is iatrogenic? Well, it means an illness caused by the comments, diagnosis, treatments, or surgeries by a healthcare professional, supposed professional. It is estimated that there are a minimum of 250,000 deaths, which occur every year due to iatrogenics. 250,000. So much for the first do no harm comment, right? In the mental health field, medication can be an important adjunct to treatment, but long term use of psychotropic meds without necessity, and there are certain instances where it will probably be necessary until we advance our science more, it causes massive problems. Now, another goodie, ECT, we've mentioned it before in this podcast, electroconvulsive therapy. It was widely used in the mid 20th century to treat all kinds of mental health conditions, including depression and schizophrenia. Yeah. While ECT can be effective in certain cases, its early use was often uncontrolled and excessively applied, leading to semi permanent or permanent memory loss, physical injuries, severe psychological trauma, etc. You know, I often thought that the reason ECT did much for anyone with depression was, hey, if I told you, Dr. Deneen, that if you told me you felt sad, that I was going to hook you up to the house current, would you tell me you're feeling sad
No, I
again?
wouldn't. I'd get better awfully fast.
Yeah, amazing. And I think that's part of the thing. The other thing is, hey, erasing memory, which ECT does. Okay, so you're eating dinner without a full plate. And what I mean by that is, you know, you need to deal with the stuff that made you depressed in the first place in one way or another. And if you don't remember them, yeah, it's pretty damned hard to deal with them, isn't it? Anyhow, modern ECT is a lot safer and more regulated. Its history, though, remains a cautionary tale about the overuse and misuse of medical treatments.
I just, as a person with a physical exceptionality, I just thought of something just came into my head. I think is very important. There's nothing, certainly nothing wrong with getting physical or mental help from a qualified professional. It's a shame not to get help when needed, but also I think it's important to realize that some things cannot necessarily go away. My dear friend, Dr. Kramer, my physical therapist, who I hope to do a podcast on, had a wonderful saying. He said, often you cure meat, not people. I mean, when I lost the ability to ambulate with my legs, that was a traumatic, difficult experience, but I made a conscious choice that while I would do the best I could to get whatever physical ability I had, I was not going to constantly try to fix what could not be fixed. That's a choice every individual has to make for themselves. Some people are more interested in the cure, some aren't. But I think we need to avoid the two extremes of pretending everything is perfect when it isn't and becoming almost obsessed with the treatment of the weak. As with most things, there is a balance, a moderation, and a long term approach.
Indeed. Well, you know, I do encourage you not to lose hope and get whatever help you need. There are many wonderful people that can help. Please let them.
Please join us again, friends. Soon we have some very interesting topics coming your way, including a look at a very famous emperor who probably would have succumbed to his disability without the love, intervention, and help of an amazing woman.
We hope you'll join us again. So until next time, bye.
Goodbye, folks.